Welcome to Discussion 10, Helping Consumers Navigate Public Health Insurance Resources. This is part of the GeauxConsumerLA Health Initiative through LSU Health Shreveport Health Sciences Library. The first two slides of Dr. Vardell's presentation, the audio was not recorded. You will hear me reading what she said from the transcript, and then it will start in on the third slide with her voice. I'm very excited to introduce Dr. Emily Vardell. She is Assistant Professor at the School of Library and Information Management at Emporia State University, and I will go ahead and give this over to her. All right, thank you, Julie. Hello, everyone. I'm looking forward to talking with you all today. As Julie mentioned, you should have a chapter available to you that looks at how to break down the health insurance reference question, and today I will talk about some of the free publicly available resources that are out there to help you support health insurance reference questions and health insurance outreach work. First, I want to share a quote with you that really speaks to me. This is from the Department of Health and Human Services.
And it really emphasizes the key role that librarians can play in this arena. So the success of health system reform will depend in large part on the capacity of individuals, families, and communities to make informed decisions about their health. So the keyword informed here makes a direct connection with the skills that librarians are equipped with to help individuals, families, and communities. And just a little bit of background on where this call came from. So in the 2013 American Library Association conference, President Obama requested assistance with from librarians in ACA implementation. And since that point, and hopefully till this day, this is an area where librarians have been called upon to provide assistance. And this is also emphasized with IMLS's call for an ethical mandate rather than governmental regulation to provide assistance with government rules and resources. So with that in mind, with that call to action, today I'm going to talk about some of the resources available to support consumers' use of health insurance. And here are the three main ones I'm going to be talking about today, and I'll go up into each of them in depth, but the Know Your Health Insurance, My Health, My Voice, and From Coverage to Care are three of the main resources I'll be highlighting today. And a bit of background information about who are we working with here. I wanted to show this data with you from the Kaiser Family Foundation that looks at health insurance marketplace plan selections. And this is just looking at the number of people who enrolled in health insurance through the health insurance marketplace. And as you can see, it was 8 million in 2014 all the way up to 12.7 million in 2016. And what this tells us is that we have millions of people with health insurance potentially for the first time. It could be that these individuals did not have health insurance before and now they do. And now that they do, they might be more likely to need assistance with the use of their health insurance. And I want to share this entertaining meme that I came across. Healthcare.gov actually posted this in 2014, but this might be what people see when they think of health insurance. Ooh, very benefits, many coverage, and it may not mean a whole lot to them. So what can we do to help support this information need? So the first resource that I would like to share with you is called Know Your Health Insurance from Merck Engage. And this is one of the most helpful resources I found for learning about how to use health insurance. And it's an interactive guide to health insurance. The FAQ covers many questions. It is created by the pharmaceutical company Merck, and as librarians, we always want to do our due diligence in evaluating the resources we use. But I have not noticed any bias in the information provided on the site. So one thing that I wanted to pull out specifically within the site, and I've got that URL there at the bottom. If you Google Know Your Health Insurance, this is what will come up. But one resource that I wanted to highlight that's particularly helpful for people who enrolled in health insurance or who are enrolling through the health insurance marketplace is this infographic that breaks down the different plan types that are available to them through the health insurance marketplace. So they use these metal categories, platinum, gold, silver, to distinguish between plan types, but it may be a little bit confusing to the average consumer. So having these kind of infographics that break down things step by step can be really helpful in giving people some additional resources to make their decisions. In addition to this infographic, They have a section featuring a graph comparing HMOs, PPOs, high deductible health plans, and other forms of health insurance. And this can be helpful to anyone, not necessarily someone selecting through the health insurance marketplace, through the Affordable Care Act, but even someone selecting through their employer-sponsored insurance who might have the choice between a PPO and a high deductible health plan, but not really understand the distinctions between them. So this graphic is pretty helpful for individuals when enrolling in health insurance plans and deciding between their available options. It may also be helpful once you've enrolled in the plan to understand how to use the coverage based on the plan type as well. But here, if you toggle between the different tabs at the top, you'll see a little bit of a breakdown. And again, they use those clear visual infographics to demonstrate the differences. In this case, the premium's lower on the high deductible health plan, higher on the PPO, but the in-network care is lower. So using those dollar signs to kind of show how the costs are distributed and what it looks like between the different plan styles. They also feature a pretty helpful glossary that includes, again, some nice visuals to indicate what the different terms might mean, and a clear description that's written at a lower reading level that's pretty easy to understand. And this list should make it clear what kind of services are covered under most health plans and some of that common terminology that you might come across. And when we think about the common terminology in health insurance and the really language-specific concerns that you have when you're thinking about navigating health insurance, that's when we think about health insurance literacy, which is, as the quote I'm pulling out here says, is a fairly new concept. There isn't a lot of research out there on this topic, but this is probably the most common definition that's used that was from a research article in 2013. And when we think about individuals' ability to interact effectively with the health insurance system, we talk about health insurance literacy. And today I really want to draw your attention to the latter part of the definition, which focuses on the use of health insurance. This is an issue that in particular has received very little attention in the media or even in research. Now that we've got people signed up, what do they do with it? What can they do with it? How are they equipped to use health insurance? So I'll be focusing on supporting the use of health insurance for the most of our webinar today. And there are a few core resources that have been developed following the passage of the ACA, which specifically focus on the use of health insurance. The first one I'd like to highlight today is called My Health, My Voice, and it's an excellent example of a resource developed specifically to help people use their health insurance. And as their homepage states, My Health, My Voice came out because of a need. Newly insured women are having trouble using their health coverage, and this fairly recently released resource is an example of something that might be helpful in supporting these information needs. This is a project from Raising Women's Voices for the Healthcare We Need and the Parsons School of Design and the Ms. Foundation for Women. So it's a joint partnership, and again, it was created after the Affordable Care Act was implemented to address the issues that people were having with newly insured women not having the skills and information they needed to effectively navigate the health insurance system. So I want to highlight a couple of the resources available within this website. And again, if you go to myhealthmyvoice.com, there is a website version, and then there are also handouts that are available within the website. And all of these 5 that I'm highlighting here are available in English and in Spanish. And while it was developed specifically with women in mind, it works with a diverse audience. And you can see a full list of the resources that they developed here. The step-by-step guide in particular includes a lengthy section with clear, easy-to-read information on understanding costs when using healthcare. And of course, when we go to use our healthcare, the cost can be one of the more complicated aspects. So it's helpful to have something that breaks it down and provides descriptions of premiums, deductibles, co-pays, and co-insurance. And as you can see, just a hint here on this slide, they use some really cool visuals to help. Each of these are a character, and it helps you understand how this might work for different individuals, and they certainly represent a multicultural and diverse audience. And why is it important to talk with people about using their health insurance? As this graphic explains, it's important to encourage individuals to use their health insurance to cover preventative health services to stay healthy. Again, people who did not have health insurance previously may have relied on the emergency room to treat health concerns in the past and may not be as familiar with using a primary care provider to address chronic diseases and preventive care. So this is something that materials that focus on the use of health insurance really try to highlight, to explain that some of these services are available at no cost with health insurance coverage, and hopefully ultimately lead to healthier individuals. I like these 5 clear steps that My Health, My Voice provides on how to use health insurance. And these clear step-by-step instructions may be very helpful for individuals who are not as familiar with how to navigate health insurance or with the healthcare system in general. I'm going to use these 5 steps to show you a little bit more about the kinds of consumer health resources available to assist with this process. So first, we'll start with learning how to use your health insurance card. So now that you've enrolled and you've gotten that card in the mail, what in the world does it mean? So the Centers for Medicare and Medicaid Services offer a helpful guide called From Coverage to Care, which offers similar information to My Health, My Voice, but there's a few more things that they offer that I think are helpful to draw your attention to, including this handout here that helps people decode their insurance card. And there's a small version there on the left-hand side of the screen that shows you what it might look like, and it's available in several languages. And this unique aspect makes it very helpful for those who are working with populations for whom English is not a native language. You can see there are several there. And again, it uses clear graphics to draw your attention to the most common things that you would find within a health insurance card, and using those numbers to call out to more specific information if people require additional details. In addition to the Learn How to Use Your Health Insurance Guide, From Coverage to Care uses this roadmap analogy to help individuals learn to use their health insurance and interact with the healthcare system. Again, I think this is helpful to see. I'm new to this system. How does it work? These steps really help show you in a logical fashion how you should navigate through the system. And as my special tip to you, you can order print copies from Coverage to Care at no cost to you, and you can print out copies of My Health, My Voice in both color and black and white at your library. You can also order copies, but there is a cost for them, and they do need help and donations to help the website keep going. But those are both available, and again, as I mentioned, in multiple languages as a resource that you could provide in print format if that's more appropriate than navigating the website version. Now that I've shown you some of those resources that can be used to help patrons learn how to use their insurance card, I want to turn to the next 2 steps in learning how to use health insurance wisely. So when it comes time to choose a primary care provider, healthcare.gov made some pretty interesting and helpful videos that are available in both English and Spanish. So for example, this video is recommending that individuals who are looking for a primary care provider should look for the names of the providers covered under their health insurance by looking online at the insurance company's website, calling the insurance company, looking at the handbook. They also recommend asking friends or looking online to see other people's opinions. Again, this isn't an area where librarians would not want to offer advice on which doctor to go to, but it's helpful to know where to point patrons to where there are resources available with additional information. And again, the nice thing about a video is it is helpful for people of a multitude of literacy backgrounds. So here this video has the individual talking. She also has some words here that we can follow along, but mostly this is helpful in an audio format to listen to and learn more. One of the things that might be really overwhelming for someone who hasn't interacted with the healthcare system very much is making that phone call to the insurance company to find out what their options are. And My Health, My Voice addresses this concern by offering sample scripts that show what kinds of questions they might expect. I think this is really helpful because I myself can get overwhelmed on the phone. People are asking me questions I'm not prepared to know. I might be intimidated to even make that phone call. So having this script that shows you the kind of questions you might get and appropriate responses can help address some of the hesitations people might have to make that phone call which is one of the many barriers individuals might face when using their health insurance coverage for the first time. Now I'd like to turn to that fourth step in the 5 steps to use your health insurance wisely. And that fourth step is being prepared for that visit. So you've got your card, you picked a provider, you made an appointment. Now I'm actually going to go and use the health insurance, and that, of course, might be yet another barrier to effectively navigating the health insurance system, is using the coverage for the first time. And there's some really helpful resources out there, and I'm going to highlight one of them in just a minute, from AHRQ, ARC. And they talk about being prepared to share family medical history and writing down your questions in advance. And when it comes to sharing family medical history, it can be helpful to be prepared in advance. So one resource that is available through myhealthmyvoice.com is this printout that you can provide for a patron that has, as you can see in graph format, a way to write down a family's history in advance. So this can be a helpful way for them to get all the information in one place and to have it in advance of going into the appointment. Because you can imagine, if you haven't had an appointment like that before and you come into the office and they're asking you to fill this all out, you might not have had any clue that this was the kind of information they were going to be requesting, and you might not have time to make the calls necessary to be able to fill out this information completely. So having a place where you can put it all down in advance and bring it with you can really help people feel equipped to get their visit off to a good start. AHRQ also has some really helpful links available that help people feel prepared to interact within their healthcare appointment. So this questions to ask your doctor is a helpful place to go. I've included the link there, and they have additional links that are related, the 10 questions you should know the answers to before you go, questions to ask before your appointment, during, and after. So again, building your own list of questions, and I really like how this empowers the individuals to feel prepared for their appointments and to get the most out of their health care now that they've spent their money on it and have invested in getting covered. Now they can use the coverage that they have more effectively, again, being prepared in advance. So all of these resources, again, could be printed out so that they can have these questions in their hands ready to go as they go to their appointment. And then finally, the last step on the using your health insurance wisely is visiting your primary care provider and taking follow-up action. So back from coverage to care, looking at that resource again, they offer some very helpful information for this step. In particular, I like how they emphasize the importance of feeling comfortable with the healthcare provider and making it clear that the patient has the option to choose another provider if they're not comfortable with the first person they went to. I think that empowerment piece is really important, saying that the doctor is not the person that you can question, that you can't second guess. If you're not comfortable with that person, you have the choice. You have the opportunity to go to a second person, go to someone else, make a change. Step 7 in the roadmap asks the patient to decide if the provider is right for them. 8 outlines the steps an individual should take for follow-up action, and one of those, for example, is to fill any prescriptions that were given and take them as directed. And many people then may be using medications for the first time, particularly preventive medications that they may not have had access to before. And it would be wise to point them to authoritative resources for drug information. I'm pretty sure you're familiar with Medline Plus at this point in this journey that you're undertaking, but I did want to highlight it once again as a great place to go if people have left the doctor's office with a particular diagnosis, with a particular prescription. This is a good place to go to find additional information on the topic. So now that I've gone through those 5 steps, I wanted to talk a little bit more about what this looks like for librarians. So again, we're not the ones giving advice necessarily, but we can help point people to the right direction, and we can do that in a multitude of different roles. And I wanted to highlight this article that I wrote with Deborah Charbonneau. It was published in the Reference Librarian, and what we focused on were the roles that reference librarians could play in addressing health insurance literacy concerns. And the first one is perhaps the most traditional, the information provider, providing that information, and these resources that I've highlighted are hopefully a helpful first step in knowing what kind of easy-to-read materials you could turn to when you want to provide information and help people decipher insurance terms and use their health insurance. There also might be librarians that are information mediators that are between individuals. They might be between an ACA navigator and a patron, and they might help that navigator locate hard-to-find information. They might also help coordinate enrollment events and act as a community builder, again, between perhaps the nonprofit organizations and the individuals who are needing information and help in this area. There also are instruction librarians who could develop materials for individuals, evaluate the materials, information managers. As people use health insurance for the first time, they might need assistance with managing their personal health insurance information, their personal health information. So now that they know they have these particular conditions, or they know they have these particular numbers after their blood tests, what do they do with this information? How can they manage it? Are there resources they should use? Should they print this out? Should they store it in a folder? Librarians are good at managing information. This might be an additional area that we could offer assistance. And then also literacy advocates, so assisting individuals in locating easy-to-read materials, and also just stressing the importance of the fact that we need these materials. Helping organizations that want to create materials, helping point them to resources they can use to develop easy-to-read materials. Again, just advocating for the importance of having these materials in an easy-to-understand format. And then lastly, a librarian researcher. So you could be conducting research in this area, looking at whether people are coming to the desk and asking these questions. What are the kinds of resources that they prefer to use? So this could be another role that librarians could play in this area. And I wanted to highlight one librarian in particular. This is from my book that I'll talk about in just a minute. So Kay Hogan Smith is an example of an information mediator. So I highlighted some and profiled some particular librarians who were offering assistance within the scope of health insurance. And Kay Hogan Smith is a community services librarian and director of Health InfoNet of Alabama. And she builds partnerships with public librarians and community organizations, again, connecting people together. She assists public librarians seeking authoritative resources to address Affordable Care Act and health insurance information needs. She does things like email notices to public librarians about training opportunities, which is the kind of thing that Julie's doing right now, locating information on coverage tiers for patients and referring to community clinics, assisting faith-based organizations with setting up enrollment events. So bringing people together. Librarians are really good at knowing who's working on what, who needs what, and connecting those people together. And when we're looking at potential community partners, here are some examples from the Roles for Librarians chapter that Margot Malachowski wrote. So if we're thinking about who can we connect together, here are some that may come first to mind, and I would love to hear more about who you might be working with. Who have you partnered with? I invite you to add the names or types of groups that you've partnered with in the health insurance arena or just with health information in general in the chat box. But here are some potential ones that might work within the scope of health insurance literacy support. So we have faith-based organizations, cultural organizations, adult literacy programs, schools, colleges, universities, emergency food pantries. These are just some of the partners that you could think of to bring people and resources together to help support this information need. So I wanted to highlight, of course, I want to disclose that I'm the editor of this book, but I wanted to highlight some of the most salient chapters of the book here. So you already had a chance to read that second one, Health Insurance Reference Question, A Step-by-Step Approach. If you haven't had the chance to read the chapter, please do go ahead and do so after our webinar today, and hopefully the resources I've highlighted will help make it even more clear what this would look like in practice. Again, we're not filling out applications for people. We're not interpreting and providing advice on which one to go with. But hopefully by knowing the resources that are out there, you can help point people in the right direction, help print out the materials, let them know what glossaries are available for understanding the information so that they can feel more empowered in making their choices. A couple of other ones that might be relevant are the role of the librarian, and there's a chapter on recommended Affordable Care Act information resources for consumers and practitioners. There's two chapters, one on consumers and one on practitioners, and hopefully that will be another helpful place to go when knowing what kind of resources you can point people to based on what their information level is at, their need level is at. And for those who are participating in this series, Roman and Littlefield was very generous enough to offer a 30% discount off of the list price using that code that's available there. So I encourage you to check that out if that's something that's of interest to you. And lastly, I just wanted to say that providing health insurance information is not a solitary game. So I provided some resources to help guide you, as well as examples of an individual who's partnering with other groups to provide quality health insurance information. And I hope now that you've attended the webinar, you won't feel as alone in answering Affordable Care Act questions. So I'm happy to take your questions now and go through anything else in further detail.
If you're not connected with a microphone, just type your question into the chat box, and we can make sure that Emily will see that, or we will read it to her anyway.
And Julie, I can't see the chat box yet. I don't know if there's a way to...
You can, if you mouse up over the top of your screen.
Oh, that's right. I remember now. Yeah. Thank you, Julie. Got it. So luckily, Julie has given you access to the slides, so you will have access to those direct links for those resources that are out there and available. I'd love to hear if there are other resources that you've used, or that question that I asked you before about community organizations that you've partnered with, or other resources that you've turned to when addressing these kind of information questions.
Okay, I don't know, Emily, are you seeing the private? Probably not. They're coming to me. So someone is saying, oh, she sent it to host and presenter. So the first one about pharmacies and do you have any comment about that?
Yeah, so there was a note on pharmacies that offer low-cost generic drugs, and that's an excellent point. So thinking about that piece that I talked about earlier, let me see if I can go back. In between getting that prescription, so the fact that they recommend filling the prescriptions that you were given, so between that and finding out more information about the prescription, knowing where to go for low-cost generic drugs, and it can be helpful to call around and get particular pricing. Some insurance coverages offer resources where you can go in and they help you locate competitive pricing. Not all health insurance companies will do that, but that might be something that you could point them to if that's something that their coverage enables. And otherwise, they can get on the phone and call, but that's an excellent point. And I see Terry's question, with all the changes in the Affordable Care Act, is there a resource you recommend to keep current? That is such an excellent question. Even in preparing these slides today and looking at the way that some of these sites looked like, let's say 2 years ago, and what they look like now, there are changes already. And healthcare.gov, many of the resources that I went to for example, a timeline, that website is no longer available. So I think that is a huge question, and one that I don't have a great answer to. I will be honest, when I'm looking at the timeline, the last time that I looked to try to find the most authoritative information, I actually went to Wikipedia, and it seemed to have a not terrible timeline. I would never normally point to Wikipedia as a place to go for the most up-to-date government information, but they seem to be doing a fairly good job of keeping the timeline up to date with the changes that are going on. I will think again if there's anything else that comes to mind, and if you know one, Terry, please feel free to share it with me as well. But you're entirely correct that there are websites that used to have more information on this topic, and that information is no longer available. So it's an area where we need people pointing to more authoritative and up-to-date information.
Do you see Lindsay's comment?
Lindsay, I see a few more. I don't think I see anything from Lindsay.
Oh, she sent it to me. I'm privately. I'm sorry, I didn't see the privately. So Lindsay says, this is great. We are actually working with our hospital social workers and case managers. That is so awesome, Lindsay. That's all I'm going to say.
Yes.
To help create a central resource area for patients to handle health insurance related questions. That needs to be a grant.
Yes.
or a study or a chapter. I'm always trying to encourage people to do research, but that's like an awesome idea, Lindsay. That's cool.
Lindsay, please feel free to email me if there's any way I can help support that. I'd love to hear how that develops over time, and if there's anything else I can do to help support it. As I mentioned, this can be a bit of a moving target, so it's really important to keep that information up to date, and I know it's an area where we can provide a lot of assistance. I'm so glad to hear you have a seat at the table.
Yes. Couple more questions from Erin.
Yep, I'm looking at Erin. So I believe Erin originally was the one that talked about low-cost generic drugs. Yes, definitely, and she said a lot of people that get through health insurance exchanges have high deductibles. And while preventive services are at no cost, people might be reluctant to use their insurance to fill prescriptions, and that is an excellent point. Again, I believe some of those resources I pointed you to in terms of navigating the actual appointment with the healthcare provider talk about, are there other drugs that might be an option, being upfront about that issue. Oftentimes physicians aren't as aware of the cost of medications, and so having that dialogue where you say, it's harder for me to pay for certain prescriptions. Is there a cheaper alternative that you can prescribe? And again, that empowerment piece where you say the physician's word is not necessarily always the final word, that there is some room for negotiation. If you take it and try to get it sold at Walmart and it turns out the medication's $50, saying, is there a way for Walmart to follow back up with the healthcare provider and ask if there's an alternative that might be more affordable for them? So again, some of the health insurance companies offer the option to do some price checking for you to save money, but it is an area where we have to encourage people to feel more empowered to make those choices so that they can fill the prescriptions. You're entirely right. They might be reluctant to use their insurance to fill them. And when you say that these lists are published publicly, are you talking about the cost of medications? Because I know that can vary by physical location too, which is why sometimes calling the pharmacy is more effective than looking online. But if there's another place that you can think of that would be helpful, please let me know. And it looks like there were some, Leah was saying there are some resources that were familiar, some new. I'm glad to hear it was helpful. And Erin's adding the cost of places like Walmart, Kroger, CVS, they have links to their list of drugs that are low cost, like $4 generic drugs. So maybe potentially if the person has internet access at home, advising them to look at the websites for these pharmacies to see what generic drug pricing is available to them. And I know some of them have their own little semi-insurance kind of plan where I believe it's at Walgreens, for example, you can pay a certain amount and then you get the medications at a lower price. That's a whole nother barrel of fish, but there are some other things that are out there to help people obtain more reasonable pricing on their medications if that's a concern for them.
All right. Well, it doesn't look like, do we have any other questions? Any other comments from anyone? I have to say, from having older parents who, when I had older parents who started Medicare and Medicaid, and Medicare when I was fairly young still, them trying to navigate that was absolutely horrible because they knew nothing about the healthcare system. And so I'm very aware of how, especially older adults, how much they struggle with a lot of times just understanding the basic things of what a copay means and, you know, deductible and, you know, what percentage they have to pay. They're having a lab test and things like that. So it's very, it's anything that we can do as librarians, I think, is very beneficial to our entire group of people that we serve. So this is fantastic, Emily.
Oh, thanks. I completely agree. You really, this is an area, you shouldn't make assumptions in any area, but in health insurance in particular, there really is no way to say even better educated people understand health insurance better. That's actually not always the case, often not the case. So you really can't draw conclusions and say this person is 50 years old and they're college educated, they should understand how health insurance works. No, not necessarily. It could be that the person who's worked at the front of the doctor's office and has an hourly paid understands health insurance a whole lot better because of their expertise in the medical, working in a healthcare setting. So again, this is an area where you wouldn't want to draw conclusions and say only people enrolling in health insurance for the first time or only people on Medicaid need help with this. No, this is an area where most people feel a little bit overwhelmed and a little bit in the dark. So I think anything that we can do, like you were saying, to help provide additional information is helpful. Not necessarily for one population, but for almost everyone can use some assistance understanding the difference between co-insurance and co-pay and things like that. So I think if this, I can't think of any library that wouldn't benefit from thinking about the kind of resources that they could provide in this area for their patrons.
So David has a question about emergency food pantries. Would you offer to be present when they are doing meals or distribute food bags locally?
Yeah, good question. So thinking about where we can build on partners, yeah, that could certainly be an area. It could be between connecting people, thinking that individuals who might be taking advantage of this or might be using those services might also be the people that are enrolling in health insurance through the health insurance marketplace. And so thinking about ways to connect those people together so that maybe you have pamphlets that are distributed at the pantries that say, next Saturday at the library, we're going to have navigators there that will help you enroll, or we're going to have assistance if you need some help understanding these terms, come to the library, or if you want to go where the people are, which is maybe even in a better model, providing a table there where you're distributing materials that help provide definitions, like that breakdown of the card, what does the card mean. Some of those materials that are handy one-pagers could be helpful to distribute at locations like that. I think that was the idea with the reaching out to that organization. And then there's a question about when people find out their doctor retires, moves, or dies, is it referring to the find a physician you mentioned to help them? I'm trying to follow the question. So
if they need to look for a new provider, even though they had an older one, can you still use that find a physician?
Yes. So let me come back and find. So in this case, this is sort of some guidelines on ways to go about locating a new person. And so certainly the find a physician within a health insurance website, that's really the first place I would send someone to if they say, I need to now make an appointment. Who do I make the appointment with? Well, you want to make sure that they're covered under your health insurance. So the most authoritative place to do that is to go on the website and use the find a physician within the health insurance website to make sure that they're in network, which is a whole other thing to explain to individuals that are not as familiar with navigating health insurance. But we want to make sure that they're in the network so that they're cheaper. If they're not able to go to the website, oftentimes you can call. It's often on the back of that insurance card, which is part of that handout that kind of drills down what's on a health insurance card. or there might be a book that they were mailed that walks them through. I think it's more likely that either going online or calling is going to be more effective, but certainly it's not necessarily just someone using it for the first time. If someone needs to change their doctor because the doctor moves or they move or circumstances change or they decide, like I was saying earlier, that that doctor is not the right fit for them, that is the best place to go to make that choice and that change.
All right. Well, we are almost at our time, so I'm going to thank Emily once again for this fantastic presentation. This was very beneficial to at least myself and I'm sure to many others as well. And her slides have been posted on our GeauxConsumer website. Also, the discount flyer is posted there as well. So if you just go to the discussion list, you can get to both of those. And now I'm going to take the power back from Emily.
Thank you.
And I'm going to tell you about what's coming up next. So, I don't know why my screen blinks like that, and I'm not sure why it does that. It sort of drives me crazy. Okay, so next week we are going to name your favorite consumer health resource lightning rounds. So to be a part of this, you need to send me an email, list your favorite consumer health resource, and you can either write a paragraph and I will read it, and I will gather a screenshot of it, or you can actually, if you want to have a microphone and would like to talk about it for 5 minutes, that's another option. We have Beyond an Apple a Day, which gives you a lot of excellent resources, but sometimes there's things that you may have come across that you have found that have been very helpful, and we'd like to highlight those in the next session. So once again, you can email me at jespar@lsuhsc.edu if you have a favorite website and would like to have write a paragraph about it, or you can actually come and talk about it. So that's March 14th. You can register at the URLs below. You don't have to actually register to be in to join the session. You do need the password though below. But if you register, then you can get a calendar reminder, and you'll get email reminders about the session that's going to start. So it's less likely that you'll forget. And once again, we're still trying to encourage people to take advantage of all of this education. So if you can, please spread the word about this. And here's the evaluation links. And I believe that I have to get out of the PowerPoint in order to paste them, unless someone else has already shared them, but I don't know if he's had a chance to do that. I'll just go ahead and paste them in right here. So there's a link to it via tiny URL and also the full URL. All right, so that's the evaluation. And once again, make sure you've done the reading. And does anyone have any last minute questions about anything? Any administrative things? All right. Well, I once again thank you, Emily, and thank you all for joining us today. And we will see you hopefully on March 14th. Thank you.
Thank you.